also invited the Overberg district in the Western Cape to share with us the success of the innovation they employed in order to ramp up the vaccinations in their region. We've also invited one of the survivors to share with us, as last week we did invite another survivor. We've invited another survivor who was also hesitant to take vaccine, but after she became a victim of this pandemic, she's going to share with us what is the sudden change of heart to now take the vaccine. We also then will be followed by the media interactions. We're going to allow the members of the media, as usual, to pose the questions to members of the panel so that we can be able to tackle some of the questions. Then the Honorable Deputy Minister, Dr. Sibongiseni Dhlomo, will do the wrap-up closing remarks. Without wasting any time, I'm going to call upon the Honorable Minister to officially open this media briefing. Over to you, Honorable Minister.
Thank you very much. Mr. Mohale. And good morning to all the participants and good morning to all the viewers and fellow panelists. Greetings also to my colleague also on the platform, Deputy Minister Dr. Sibongiseni Dhlomo. I want to take this opportunity to thank all the media platforms for this opportunity for us to brief South Africans on the progress and challenges in our battle against the COVID-19 pandemic. I thank all the panelists this morning. Special thanks, as Mr. Mohale has indicated, we have with us this morning Ms. Lerato Moletsane. We really appreciate her participation for agreeing to come and share her personal experience in the battle against COVID-19. We think this is very important because when we bring people who have personal experiences, it actually brings the human face to the whole battle against COVID-19. Ladies and gentlemen, this morning we can say to you that this third wave, the third wave is continuing to behave in a very unpredictable manner. It's behaving differently as compared to the first and the second waves. The case trajectory had shown initially a steep downward trend since the 9th of July. However, since the 13th of August, cases started to trend upwards again after it had started to on a downward steep. This fluctuation can also be seen in individual provinces, not only in terms of the national graph, the national curve. As we always say, the main aim is to flatten the curve. Now, this curve is behaving quite different. And this is more so when you look even at individual provinces, like the Western Cape, the Northern Cape, and the Free State, especially those three provinces. But what we must say is that the encouraging thing is that as far as Gauteng province, as we know that Gauteng has been the epicenter of the third wave when it started. In the Gauteng province, there has been a sustained and continuous downward trend, which is indeed very encouraging. Over the last 7 days, there has been a 2.2% decrease in new cases, which is not a very good progress. It's still very slow. The 2.2% is still a very low reduction. The last 3 days of just this week, tests on a daily basis have remained between the positive tests have remained between 10,000 and 13,000 positive cases a day, which is still very high, with an average positivity rate of between 19 and 20%, which means we are still very far from the WHO recommendation to say that you are stabilizing, because the WHO regards 5% as indeed where we can say that the country is stabilizing. So we are still very high at an average of 19 to 20%. Active cases over the last 7 days increased by 1% to 169,000 a day. Admission to hospitals have reduced, which is quite encouraging, by 0.7% to an average of 13,600 as of yesterday. It's a small reduction, 0.7%, but we do welcome, because any reduction in hospitalization means that our health facilities are under less pressure and our health workers can have a breathing space. Over the last 7 days, average hospitalization has reduced by 3.3%. Again, a very welcome development. New cases reduced by 2.2%, small but welcome, even though there have been increases in the Eastern Cape, in KZN, in Northern Cape, and also in the Free State over the last 7 days. By yesterday, on the side of the fatalities, the death rates, unfortunately, and we must say condolences to all the departed. By yesterday, in total, as South Africa, we had lost just over 80,000 people, 80,826. And as of yesterday, the new reported deaths were at 357. Even though we were saying that the average positivity has been 19%, regrettably, 2 provinces have still had very high positive rates, and that is the Western Cape and the Northern Cape. The Western Cape had an average of 27% positive rate daily, and also as of yesterday, in the Northern Cape at 30%. Now, what is worrying is also that the Northern Cape has remained high, the numbers relative to its population, and that's why its positivity rate remained very high over a prolonged period. In fact, analysts, our epidemiologists often say that the Northern Cape never came out of the second wave. It came straight into the third wave. Now, another worrying trend is that in both provinces, there has been more younger people between the ages of 10 and 19 who have been testing positive. While some clusters can be traced to the opening of schools, there are also indications that social activities have also had a role to play, such as young people engaging in parties without any precautions. So this has played a major role as well. Now, what this means is that the third wave, it's dragging longer than the first wave and the second wave, which went up to the peak nationally and then started going down quite steeply. But the third wave is dragging at a high level. Sometimes it looks as if there's going to be a steep downwards, and then it rises again. And in the absence of new variants, what this means is that many of us are not observing the prescribed precautions. Now, the risk of this is that by the time the fourth wave, which is predicted to come somewhere around November, by the time the fourth wave, possibly driven by a new variant, by the time it comes, it may find us still at the tail end of the third wave, which will mean that our health facilities and especially our health workers would not have had much rest. So this is something which is worrying, and we urge all South Africans, therefore, to observe the known protocols. Ladies and gentlemen, on the vaccine side of the prevention of COVID-19 and management of prevention of serious illness, I want to say that the development looks much more promising on that side, judging from 3 factors which are going to determine our success. And that the first one is in terms of the stability of the supply of the vaccines. Secondly is our capacity to sustain the delivery of the vaccines to the population. And lastly is the uptake of these vaccines. These are the 3 factors: the supply side, the ability to administer the vaccines to the people, and lastly, the appetite of the people to actually come and receive the vaccines. Now, if all 3 are going well, then it means we're doing well on this side. Now, as we know, exactly 7 days ago, on Friday last week, we opened up registration and vaccination for everybody over the age of 18, in other words, for all adults. And therefore, this meant that we, having come from the 60 up, 50 up, now and 35 up, we're now opening for the 18 to 34 years, giving them the opportunity to receive the vaccine. The response of our young people, who are indeed the future of our country, has been quite overwhelming. On the first day, on the 20th of August, we registered more than 560,000 people on the EVDS system, and we also vaccinated 81,000 of the young people of the 18 to 34. Not the total vaccination, but just in the category of 18 to 34, we vaccinated 81,000 in one day. Even the weekend numbers went much higher, and since Monday the 23rd, our overall daily vaccinations have been above 240,000, and that was also the figure which in total we were able to vaccinate on Friday the 20th. So this number was sustained. A good increase also on weekends, which we generally don't have huge numbers. But on Monday, we were able to get back to the numbers of Friday the 20th, on Monday the 23rd. And then we even went up to reach 260 and 268,000 on Wednesday, and 265,000 on Thursday. Yesterday, we reached 265,000 vaccinations in one day. For the 18 to 34 vaccinations, as I said, we reached 81,000 on Friday the 20th, and the following on the Monday, we're able to reach 93,000. That is on the 23rd. On the 24th, another high figure of 99,000, and also 98,000 on the 25th. And yesterday, on the 26th, we were able to reach a figure of 89,000. That is only for those in the category of 18 to 34. So indeed, a very overwhelming response from our young people. In terms of the provincial share of this 18 to 34 cohort, the province of Gauteng has already vaccinated 158,000 since the opening of the category of 18 to 34, which was followed by the province of the Western Cape with 106,000, KZN with 83,000, Limpopo, that is up to yesterday, all these numbers, Limpopo 42,000, the Eastern Cape with 37,000, Mpumalanga with 35,000, Free State 22,000, the Northwest 23,000, and the Northern Cape 8,000. As of last night, the total number of vaccines administered, last night, in terms of total vaccines administered, we reached 11,648,000, an increase of just a little under 1.5 million over 7 days, which is indeed another new record. The total number of individuals with at least one jab of either J&J or Pfizer, as of last night, we had reached 8.841 million people, which is just over 1 million more than the previous week at the same time, last Friday. That we are now 1 million more people have received at least one jab of either of the two vaccines. The total number of people who are now fully vaccinated with either one dose of J&J or 2 doses of the Pfizer vaccine has now surpassed 5.450, in other words, 5,450,000, which is over 850,000 more than the previous week. The good news also is that the male to female ratio is also narrowing. Possibly, I believe that this is possibly because of the younger people, both male and female, are coming forward to vaccinate. It used to be sometimes 61 to 39%, but as of yesterday, the female vaccinated percentage was 58.5, and the male were at 41.5. So there's an improvement on the male uptake, which we really encourage, and appreciate. The last 7 days have shown that indeed, as a country, we do have the capacity to administer the vaccines, and we do have the necessary supplies. It shows that indeed we can even reach the 300,000 daily vaccination target, which has been set for us by our Excellency President Ramaphosa. We are happy that many people are ignoring the fake news, which are still circulating in our midst, peddled by, even amongst others, a few of health professionals also joined in the fray. We urge our young people to continue to come forward, but also encourage their parents and their older friends and relatives to also come forward, because we still have a major gap to cover in terms of especially the over 50 and the 35 plus. Now, amongst other matters which over the week has been coming forward, there's been suggestions which have been made by a number of influential people that we should consider a mandatory vaccination policy. This is a matter which we are very reluctant to venture into, but it's a matter which we are discussing at various forums to see whether this is an option. At this stage, it's just a suggestion which we are looking at. We have also noted discussions taking place among some of our professionals and also amongst various role players about a possible Johnson & Johnson booster vaccine. This matter has, we are not ignoring the discussions around this matter. We have referred this to our Vaccine Ministerial Advisory Committee to advise us. But I must emphasize that our priority at this stage is to make sure that all adult South Africans who are willing to get the vaccine should get a dose as prescribed. In other words, a single dose of J&J or a double dose of Pfizer and any other vaccines which we will acquire in future. At this stage, our focus is making sure that we do reach a population immunity coverage. So the other debates are not really our priority. We're considering them, we're referring them to our specialists, but these are not preoccupying our minds. We're grateful that the government and the people of the United States of America have again donated to us through the COVAX facility another 2.2 million doses of the Pfizer vaccine, which we will be receiving tomorrow on the 28th of August, which will be in addition to the 5.6 million which we already received in July. So this will take us a long way in terms of reinforcing our stock of vaccines and also making sure that we indeed have very stable vaccine supply. We again wish to thank our health workers, our frontline health workers who continue to save many lives. Let us on our side as the population do our part in terms of taking the vaccine so that we can be able to relieve the pressure on our precious health workforce on the front line. The COVID-19, this COVID-19 fight, the battle against COVID-19 can be won if we continue to work together, observe all the protocols, but also make sure that all of us take our vaccine as long as we qualify. And at this stage, as we have opened for everybody above 18 years old, it means all adult South Africans are now eligible to can take the vaccine. So we urge everybody, please, to come forward so that we can all be protected. As we know that it is almost accepted that somewhere towards the end of the year, we will have the fourth wave, and we want to make sure that all South Africans can be protected against that fourth wave by taking the vaccination. Thank you very much, ladies and gentlemen. Back to you, Mr. Mohale.
Thank you, Honourable Minister, for that comprehensive update as far as the vaccinations, the rollout is concerned. Indeed, it shows that our men, they've heeded our call to come in numbers to vaccinate in order to protect their families and their loved ones. And also, let's thank the younger generation, the 18 to 34. Indeed, they heeded our call. They came in numbers. They assisted us to push the numbers to where we are today. And we believe that they will continue coming, not only alone, but also with their elderly parents, the uncles who have not vaccinated, so that all of them, they are safe. Without wasting any time, I'm going to call upon Dr. Rolin Wagner. She's the HOD Head of Department of Health in the Eastern Cape. As you know, colleagues, that the Eastern Cape is one of the provinces which were the hardest hit by the second wave, but now it seems they've managed to turn things around. Today, we are going to allow Dr. Wagner to share with us their secret of success, the best practices on how they managed to turn things around. Dr. Wagner, over to you.
Thank you very much, Program Director. Good morning, Honourable Minister and our Deputy Minister, Honourable MECs, our senior officials, as well as the members of the media. Thank you very much for this opportunity to share with you the vaccination progress in the Eastern Cape. I will touch on in the presentation the trends and performance of vaccinations, the program in the Eastern Cape, some of the observations from these trends, and then how we're planning to ramp up in the ensuing days. With respect to persons registered, the Eastern Cape Province has registered 1.288 million people out of the targeted 4.09 million people. When we look at the age distribution, the biggest proportion is that of the 60 plus years. That is the 69% of our 60 plus have been registered already. This is followed by the 50 to 59 years. And as the Honourable Minister was saying, we've just opened up the 18 to 34 years, but already 7% of our target market has been reached. So that gives us an average of 31% of our eligible persons that we're targeting having registered. Now, how those have translated into vaccinations. We have vaccinated just over 1.107 million people out of the targeted eligible persons. The largest number that have been vaccinated, or the largest proportion, is in the 60 plus years. And so that's because we've had a really significant drive in targeting those most at risk, those over 60. We do observe, though, that the proportion registered of the targeted 60 plus is 69% registered, and yet we've only vaccinated 59%. So we need to close that gap. But we're very pleased at the progress we've made in this particular age group. The National Department of Health has set us targets over time. And when we started at the beginning of August, which is week 12, we were a little bit behind our targets, but we're quite pleased that as we moved on across the month of August, we've been closing that gap between our daily actual vaccinations and the target of 42,000 by month end. The highest daily vaccinations was this past Wednesday, where we vaccinated 37,901 people. This is a 44% improvement on the vaccinations started on the 2nd of August. When we break that down to see what the contribution was on this highest total of 37,901, the largest number of people vaccinated came from the Nelson Mandela Metro. 21% of that total came from that area, followed by Amatoli and OR Tambo, which made up 15 and 14% respectively. And then close behind them is Chris Hani and Buffalo City Municipality, each accounting for about 13% of that 37,901. Even though in the previous slide, we saw that Nelson Mandela made the largest contribution, I think it's also important that we recognize the improvement. So if we look at where the districts were on Monday the 2nd, compared to the highest dose of vaccinations done on Wednesday the 25th, we can see that the biggest improvements came through pushes in Amatoli district as well as Sarabatman. Those were 77 and 73% improvements from where they were at the start of the month. So that's really significant. Followed by Chris Hani with a 63% improvement, and then our Tambo and Nelson Mandela behind. Even though Nelson Mandela was a 32%, a smaller proportion of improvement, they were already moving off a high base at the start. So our primary strategy has been to ensure that sites are closest to where people live in the community. And this graph shows that when we look at the distribution of sites, the proportion of primary healthcare sites make up a significant portion of all of the sites that are available in providing vaccination services. When we break it down, this just compares it. So 88 sites are hospitals, but 733 sites are in the primary healthcare. And then, of course, to take it even closer to the community, a further 31% is located in communities. And so those two together account for 92% of where sites are located. When we break it down by district, most of the sites at this stage are in the central region of our province, followed by the western region, which, as you're aware, was where our hotspot and the epicenter of the resurgence has been. This just unpacks the types of primary healthcare fixed sites, and you can see that 82% of our primary sites are sitting at our clinics, followed by the community health centers. And we also have been working with our pharmacies in these respective regions. There are 51 private sector pharmacies who also are vaccinating. And this is a busy slide. I think the reason that it was put in was just to show how we've supplemented these fixed sites located at our clinics and the pharmacies by doing a number of other activities. And so you'll see that 36% of our vaccination has taken place at halls. So those are sites that we've identified to do outreach services to, as well as our old age homes. So we had 121 old age home and care facilities that were pop-up vaccination sites. I suppose that it reinforces why we had such a good increase in our over 60s being vaccinated, because we specifically targeted and went out, did outreach visits to these sites. These sites were linked to our nearest facility. And then the other area where we did outreach services was at our schools. There was a big drive to vaccinate all of our educators in the province, and that was quite a successful endeavor as well, contributing to the total numbers of people vaccinated in our province. So our observations are in this graph, the target population, the biggest block is the orange block. Now that orange block are your youth. It's your 18 to 34s, followed by the 35 to 49s. So when we look at registered, proportion registered, and we look at vaccinations, at this stage, the 60 pluses are getting close to the target. Followed then by the 50 to 59s, who are also, we're about halfway to the target. But if we are wanting to achieve herd immunity, it's going to be important for us to start driving the 18 to 34s. The other observation that we've made is that in this third wave, like the patterns in the rest of the province, there's a significant reduction in the numbers of hospital admissions. And this also, we've also seen a significant reduction in the numbers of deaths in the third wave compared to other waves. And we do believe that this is related to the impact of vaccinations already possibly pushing through in our patterns. So given that we are now saying that we need to make sure we target our at-risk groups, so these are our over 50s now, to close the gap on the 50 pluses and to close out the 60 pluses, we also now need to be bringing online the chasing the herd immunity. So the first lot of activities we have is at encouraging registration. And so we have communication going out constantly in various forms, reminding people to register and also sharing information on how to get registered. We also want to make it easy. There are existing sites, and so we've uploaded onto our website. We've done 3 of our districts already, and it's one place where any citizen can go to find exactly where the site is in their sub-district. We also, on a weekly basis now, we've started putting out the pop-up sites, but we're ramping this up so that by next week, we will have all of our sites uploaded, and every week we'll notify people of where the pop-up sites are occurring. We also are expanding the number of sites if we want to reach and exceed. We actually don't want to just reach, we want to exceed the target that has been set for us. And so all of our district managers within their district have employed a number of different strategies to make sure that in these next couple of days and weeks, we have more sites that are coming online. In OR Tambo, the executive mayor has made the stadium available for a drive-through. It's behind one of our malls. There's also a proposal underway to have a drive-through temporal site in Bizana to assist us in ramping up. We've got more pop-up sites that are coming online each week. These are in partnership with our retailers. And again, you can see from the list that it goes from the western part of our province all the way to the eastern part of our province. We are going to be looking at the pop-up sites at SASSA pay points at the beginning of September. Jokabi and Amatole are in fact starting as early as next week. The whole idea is to take and expand sites, take the services to where people are. So our Trans-Vaco train will be starting on the 2nd of September. We propose that it will stop for 2 weeks at each of the stations listed. We also, given that we're wanting to drive the 18 to 34s, we also wanting to go where people are working. And so we've got partnerships with industry, and all of the occupational health sites and health clinics are now providing vaccination services. The Eastern Cape, as you're aware, has got a huge industry in the car manufacturing industry, and they've all come on board, both in both of our metros, but also in the universities also have occupational health clinics, and they've also commenced a service for vaccinating students at their clinic. The retailers, we really are encouraged by how many retailers have come on board, and they, from your spas to your Unifracs, I mean, the list is just endless. We are absolutely overwhelmed by the positive energy coming from business sector to work with government in this endeavor. We also wanted to make it convenient. So these are just some of the photos to show that we've gone to where people are shopping, and we found the citizens are actually, they welcome this kind of initiative. Besides expanding the numbers of sites, we also need to create demand. And so we're wanting to create demand specifically around our target groups, but also to address vaccine hesitancy. And so our target groups, as I was saying, would be the youth. We've also found in our province that 60% of those vaccinated are women. So that's a really disproportionate large number of women, and a relatively much smaller component of men making up those who've been vaccinated. And so we are going to be targeting men. Our traditional councils have made their council halls available as places where we can attract men and market the vaccination program. With respect to social marketing, one of the initiatives the National Department of Health is assisting us by providing free transport to the Momentum vaccination site in Grobegge from the underserviced areas to our Momentum vaccination sites. This is just our deputy mayor in Grobegge. It's just absolutely overwhelming how our local councillors, as well as our politicians, our executive mayors, our premier, our MECs, everyone has gotten on board to try and be part of this movement to encourage vaccination in our province. With respect to targeting youth, our province has 925 schools that have learners 18 years and above. And so the Department of Education has made the vaccination sites available. These are the same sites that we utilized when vaccinating the educators. We're clustering our schools. So where there is a school with a bigger hall, we're using that as a temporal vaccination site, and other schools around it will then bring their students into those sites. We are scheduling our learners so that we can avoid the congestion at the sites. Our districts are currently also doing outreach to TVET colleges and schools that are within 5 to 7.5 kilometers from the vaccination sites. And our universities are now being activated as temporal outreach sites. We also want to utilize our weekends to try and target learners from schools as well as the TVET colleges, plus the general population on weekends. This is just one of the examples. I think you may have seen this in Limpopo, where the UNICEF truck goes to schools and has recorded messages and music that plays. In our province, it started in Sarabartman at the beginning of August, and it's now moved into the OR Tambo region. With respect to targeting men, we've got a number of communication material, but we're trying to find ways in which people, and men in particular, can relate to and can resonate with. And so here we've got testimony from what we're calling our stars or influencers, people who've already taken the vaccination jabs, and sharing with us photos and their statements about being vaccinated. And here we've even had our traditional leaders who've been vaccinated doing recordings that we're playing over radio in order to encourage people and share their experience of being vaccinated. We also, all government meetings where government officials are convened or where they're convening with community members, they're utilizing those opportunities to promote the vaccination program. The taxi drivers are predominantly males, and so we have been targeting working with the taxi industries as well as the taxi ranks. And then this is an initiative that we started on Wednesday. One of the business, he actually owns a restaurant, and he approached us about holding a vaccination party. And of course, we were a little bit concerned, thinking, gosh, party crowds, etc. But I think in partnership with him, what he's trying to promote is that it's cool to be a vaxxer. So this particular restaurant, it's a very popular restaurant in Hemingway's, is offering a vaccination special platter for 4 after you've gotten your jab, or if you can show your vaccination card proving that you've been vaccinated. They still are observing all of the non-pharmaceutical interventions and the COVID-19 regulations in doing so. And then, of course, even though we're increasing our numbers of sites and we're trying to create demand, we recognize that we're a little bit behind the target cumulatively. And so we are planning mass vaccination sites so that we can accelerate and mop up, but also do both. We want to mop up our backlog, but we also want to accelerate the program by having these mass vaccination sites. At this stage, it's planned for Buffalo City Metro and in the Nelson Mandela Metro, but we also are planning to have sites out in Mthatha. In fact, if I could use this opportunity, Honourable Minister, as well as the media, we're having a drive-through site at Hemingway's Mall this weekend. It's both Saturday and Sunday, and it will be there from 8 o'clock until 5 o'clock in the evening. And then I think it's very important that as much as we recognize that we've still got a way to go, we were very excited when 2 weeks ago we were the lead province in the country with respect to vaccinating. And it's important for us to celebrate these successes because they encourage everybody who's part of this movement, both our citizens as well as our politicians, our leaders, community leaders. But it's also because we recognize that the Eastern Cape is not an easy province for a number of reasons. We have the historical backlog and challenges of it being a rural province, and it's really difficult to reach some communities because they're so far flung. And so when we have achievements and we're making strides, positive strides, it's really important that we celebrate this. And our MEC was very proactive in celebrating the successes. She not only wrote a media statement for our staff to recognize all of their efforts and to celebrate with our staff, but we also did media releases where our MEC acknowledged and appreciated both our citizens for participating in the program, but also our partners. Without our strategic partners, it would be very difficult to be achieving some of these tasks, given the challenges we have with resources being highly constrained. What was also exciting is that we sometimes get messages from people who know us, who have been vaccinated. And we can see that even our citizens, once they're vaccinated, are really excited about the fact that they're now vaccinated and are affording themselves and contributing to the community having some protection. So that concludes the presentation, Honourable Minister. I just want to thank both the Honourable Minister and the National Department of Health, our strategic partners, the Eastern Cape Provincial Government, who's been leading and driving this at a central level from the Office of the Premier, and our MEC, but also to our community, business and religious leaders who've been working with our communities to ensure that this program is going to be a success and that we reach our target ultimately of herd immunity as soon as we possibly can. Thank you, MEC, Honourable Minister.
Thank you, Dr. Rolin Wagner, for your presentation. We can see that a lot has been done in the province. You managed to turn things around. I remember during the second wave, a number of your municipalities were declared the hotspots, but now we can see that a lot has been done to turn things around. Well done to the province, and we believe we'll keep it up so that we reach as many people as possible, so that by the time we are hit by the fourth wave, majority of our people will be well protected. Thank you. Thank you, Minister and colleagues. Without wasting any time, I'm going to call upon our next presenter from the Western Cape Overberg district. As we know that we try to bring those who have best practices, good strategies that have worked for them in their districts and the provinces, in order to share with the rest, so that no province, no district, no local municipality is left behind as far as vaccination is concerned. Different provinces have adopted different strategies and innovation. Today we are going to hear the innovation that assisted the Overberg district in the Western Cape to reach as many people as possible. So I'm going to call upon the district manager for health services, Ms. Velemin Kamfa, to take us through the innovations and how it assisted them to reach the numbers they've reached. Over to you, Ms. Kamfa. Hi, Velemin. Ms. Kamfa?
Yes, thank you. Good morning. I am here. Let me just.
Can you show your face as you prepare to show us your slides?
This is the slides. Can you see it?
Not visible on my side.
Share screen.
Share the
screen. Can you see it now?
Not yet.
Okay, there you are. Can you see it now?
It's coming through. Yes, and also show your face so that people, the media, members of the public, will see who's Velemin Kamfa.
Good morning, Honourable Minister. Can you see and hear me now?
Yes, can go on and put it on a slide show.
Slide show. There you are.
Wonderful. Can go ahead.
Let me just start, just to show you. Good morning, Honourable Minister and all the dignitaries and people attending this meeting. I'm really honoured to present from the Overberg district, and really we did so well there that I am honoured to share it with you. This is the Overberg. Sorry to just, I need to share this, one of the most beautiful areas in our country. And this is our 4 municipalities in the Overberg district. It's Theewaterskloof, Cape Agulhas, Swellendam, and Overstrand. Yes, Overberg remains the district with the highest numbers of registration of people, especially over 60. Currently, we at 96.7% of our population over 60 that are registered, and we have vaccinated 84.5% of those people. The registration of the other categories are also amongst the highest in our province and are picking up, not where we want it to be, but it is picking up. The success is attributed to the partnerships. That is the main crux of this, the partnership between the Department of Health and our local NPOs, our contracted and NPOs in the district. This is just the registrations on the 25th of August. As you can see, the different sub-districts. Over 60, the 50 to 59, the 35, and the over 80. 60, as I said, 96.7, the highest registrations in Overstrand, 110%. Our 50 to 59 already at 53%, and Theewaterskloof and Overstrand, Cape Agulhas, they all over 50%. Our 35 to 49 is 38.7% at the moment, and our 18 to 34 years of age is at 11.4%. They just started now, and we are in the process of checking them up a bit. This is just to show the vaccine cascade that we receive daily from our provincial office. The key indicators, where's our registrations, vaccinations, and coverage. The next slide is just to show that our population, registrations, and percentages, and this is done for all the age brackets. I just highlighted this age bracket. Now you can see, as I refer to that cascade, it contains the information of all the age groups. It indicates our progress on a daily basis. Then we can also have a further breakdown into the specific areas in a particular sub-district so that we can see where we need to target. It points out our low uptake areas so that we can focus on it. This vaccine cascade is distributed to all our vaccine leads within our district, our district jogs, our sub-district teams, so that they can discuss it at all the different platforms, our jog meetings, local municipality meetings, management check-in meetings, our NPO engagements, our stakeholder engagements, and it's for information sharing on social media. So it's disseminated to each and every one that is interested or is a stakeholder of us. This is just an example of the further breakdown where we can see, this was now on 31st May, I just want to show this, that in Elim, for example, at that stage, none of the people were registered, so we know we need to go in there. We need to go into Infanta, Arneson, so we are targeting those low uptake areas. And our local municipalities is key in daily messaging to the communities. And this is also just to show a map that's also being shared with us so that we can see the percentage of registrations every day. So how did we do it? It can only be done with partners. Our NPO, our municipalities, our faith-based organizations, all our partners and Department of Health. And that combination feed into the high numbers of registrations. We have our NPOs, as I said, our contracted NPOs, our municipalities, our churches, our pastors, local social media, schools, two songs, private sector, retail, farming community, everybody was involved in the registration process. When we started with this, I must say we had dedicated management teams in our 4 sub-districts that took the challenge ASAP. Before it was formal, they were organized with the local municipalities to do the registration. The messaging went out to all platforms. I must say we have an older population, especially in Cape Agulhas and Overstrand. There are popular retirement areas. And like in Hermanus, there are 9 retirement villages. We had to adopt a parent, adopt an aunt, adopt a gogo, where the children are encouraged children encourage their parents and their families to register. We targeted people with comorbidities. As people voice their fears of contracting COVID, we use that opportunity to get people to register. Our older people, and the retired people, they want to travel. That was a factor that the people said, I want to register because I want to go to my children. I want to go overseas. There's lots of business people that need to travel. So we use that as an area to say, now let's do it. Farm outreaches in the Overberg district has been a huge success. And we received quite positive feedback from our farms and outlying community as we reached out. We said, let us go to you. We have our mobile services, but we also have a huge outreach to our farming communities. And later on, the bulk uploads with the farms were quite a good strategy. The communities are happy to receive their vaccines closer, and we use that as also a registration opportunity. Our JOGs and local authorities, they use their community development workers through their JOGs, and they were, as we say, boots on the ground. They were at all taxi ranks, at all places where people going to businesses everywhere. They were our soldiers on the ground. The municipal support with self-registration and messaging, the local JOG discussions weekly, loud hailing in certain areas. We had the UNICEF truck with us. And very interesting, the UNICEF truck also attracted the anti-vaxxers somehow in 2 of our towns. But very interesting, this didn't say to people, no, we don't want to register. We could use their messaging also to convince people to register. We had social media and other media advocacy, WhatsApp groups. I didn't know we can have so many WhatsApp groups. Retired people, neighborhoods, everyone had a group to encourage fellow people to register. Then we had a heat map of progress, encouraging people to register. So they say, this is our registers, this is what we do, this is our progress, please come, we need your registrations. And sharing, information sharing, I think that was the crux of the matter. Then our local politicians, I must say that they came on board from day one. And this is just a photo of our deputy mayor in the Overberg with his loud hailing into the community and encouraging people to register. Our faith-based organization, when we started with the registration, it was our Pentecost ceremonies where people were helped to self-register. They gave support to the elderly. They used their social platforms of the churches. They did it on church announcements, their WhatsApp groups, and they campaigned to help all the people to register. And then organized church management clusters, like the Zionist Church group, with the chaplaincy, they jumped in and support us in the registration campaign. The NPO sector, they use cell phones, they did home visits, an integrated service where they register people and also do screening. We allocate community healthcare workers to alternative registration sites. When the cell phones become a safety risk, they complete paper-based and then go to the office and do it electronically. They help at our chronic disease unit sites with registrations. They use their own offices at site, and they did wonderful outreach to shopping malls, clinics, community halls, all the hard-to-reach communities. And this is, there you can see Whale Coast Mall. They're sitting on the whale, and they do the registrations, and they do home visits and in their offices as well. Partners, we use our Tusong centers, individual visits to institutions, partners, retail. The businesses is very appreciative of our partners going into them, explain to people, and then we get the registration up and running. We recommend to people that they use the free Wi-Fi hotspots like schools, library, clinics, and other departments, and then we link up with all the farming communities. When we started this, the health sector, they went in and they early initiating support, setting up self-registration sites at clinics, central points in town, with support to the NPO sector. What we also do is using non-vaccination days in our smaller towns. We are not open in all the small towns every day, but on the days there's not vaccination, we do the registration. So when the vaccination comes in, the lines go quicker. And then the chronic disease groups, registrations done when home deliveries were done or when they collect their medication. Staff also helping if someone needs help. Admin clerks at reception or registration offer help with each contact with a person. The standard question will be, do you need support to register for vaccinations? And we use our reports, as I showed earlier, to target registration interventions. And our radios, local radio stations, are open right through for us to send the messages. And we all, from myself to the doctors to all the people that can influence in the community, we all have slots to go and speak to the communities. And then we target also, our outreach for how to reach people. And this is just fishermen in Struisbaai. While they're registering, the others are being vaccinated. And the people really appreciate this. This is our door-to-door registration, as we say, boots on the ground. This is at the facility where the people comes in everywhere where they can put up a stand, as they say, they will put it up. And this is where we go into our communities. And I think my time is up. Thank you so much.
Thank you, Ms. Kamfa, for sharing with us your good practices that we believe other municipalities, provinces will adopt in order to ramp up the vaccination program in their respective provinces. Without wasting any time, I'm going to call upon our special guest today, is Ms. Lerato Moletsane, as Minister has already introduced her. She's going to take us through the impact of misinformation and fake news, which almost costed her life because she paid more attention on misinformation, fake news, than taking a vaccine. So she's going to share with us experiences why she decided to suddenly take a vaccine and abandon all those misinformation and fake news. Ms. Lerato Moletsane, over to you.
Hi, good morning.
Morning, Lerato.
Hi, okay, special. I don't feel special at all. Good morning, the Honorable Minister and Mr. Foster Mohale. Thank you for the invitation, and dumelang to everybody who is who's attending. As you've already...
Just to interrupt you, can you go back? You are too close to the camera so that they can see your full face, Lerato.
Yo. Okay, so let's take this back here. Is it fine?
It's fine, but just try to turn your camera so that it can be visible. Okay. No, it's fine. You can continue.
So you can see me. Okay. So I have been vaccine hesitant for, I don't know, for quite some time. I was also one of the people that thought COVID is, does not exist. It's just a hoax and it's man-made. So for me, having to vaccinate was never something that I was going to do. It was never on my mind. and until I fell sick. I got tested positive on the 20th of June. This after my husband tested positive. So as soon as my husband told me that he has tested positive, I immediately got sick. I had panic attacks, I had anxieties, and as a person living with mental health issues, this was not good for me. So on the 20th was a Sunday. So a Thursday, my husband told me he was positive, and Friday I started getting sick. Saturday I was flat. I was flat out. I was knocked out, and I see myself as a very resilient person. But this thing just humbled me, and I went to test on a Sunday. I was told that I was positive, and I was told not to go anywhere and get the medication from get somebody to get the medication for me from the pharmacy. So I got the medication, and for the next 9 days, I was flat. Husband positive, he was not as sick as I was. And for somebody who is active, in the previous Sunday before I got tested, I ran 45 kilometers, and I consider myself fairly fit. But the way this COVID knocked me, it was something that I've never really experienced, and I never want to experience this ever again. So that changed my mind. I decided to then, you know what, I can't put myself through this, and more than anything, I have to do it for other people. So if I get vaccinated, at least there is a limited chance of others the other people close to me getting contracting this virus. So let me do it. If not for me, let me do it for the people that are close to me. So I went for to be vaccinated. I think I was vaccinated just recently. On Wednesday, yes, I had my first jab at Discovery, and the process was seamless. And I am happy that now, I have changed from being vaccine hesitant to being pro-vaccine. And I know that if we all can have this done, it will make our communities thrive again. I was excited on Tuesday when my daughter, who is she's 20. She sent me an SMS saying, "Mama, I've just vaccinated." And that for me is like, okay, wow, we are heading in the right direction. So if all of us can have this positivity and, take this power, we have this power to make a difference. I think somebody once said, with great power comes great responsibility. So the power is with us. We have the power to make a difference. Let's just all get this vaccine and go back to having our communities thrive. So that is it, I think, for me, unless there's anything that you want to know from me.
Thanks, Lerato. No, thanks for your brief testimony as far as COVID and your misinformation, how it affected you is concerned. Thanks. Yeah, we can switch off the camera now. We continue. We hope other people who have paid attention to your testimony will be able to stop wasting their time, stop hesitancy, and go and register and vaccinate to protect themselves and their loved ones. Thank you, Lerato.
Thank you.
You can switch off your camera.
Thank you very much, Foster. Let me just also thank Lerato for coming forward. I know that it must have taken some courage, and I hope it will inspire others in listening to a personal testimonial. Thank you very much.
Thank you, Honorable Minister. In most cases, you will hear people asking you about the impact of side effects of COVID-19, but they won't ask you about the COVID-19, the pandemic itself. So they fear the side effects more than the real enemy. And people need to know that COVID-19 has got no friend. It doesn't respect anybody, regardless of your age, socioeconomic status. People must just do the right thing, protect themselves by taking this life-saving treatment. Without wasting any time, we are going to take a few questions. It's that time of questions and answers. I've received a number of questions through the chat and also directly through the WhatsApp group. But I see other questions have already been attended to. And I want to urge our panelists to assist us by answering other questions that appear on the chat directly so that you can be able to deal with the ones that are not yet answered. Without wasting any time, I'm going to read the first batch of questions. You'll tell me, colleagues, if they've been attended to or not. The first question is from Mr. Jonisan Marombo, who says, what is the department doing to counter the narrative pushed by the anti-vaxxers? What are we doing as the department to counter the narrative pushed by the anti-vaxxers? The second one is, why should we sign the waiver letter? Why should they sign a waiver letter? The third one, I think the minister has already touched on it during the remarks. It says, it reads as follows: will the vaccine become a compulsory in the near future like other countries? Will the vaccine become a compulsory or mandatory in South Africa like other countries? The fourth question is about population. Somebody suggesting that instead of us focusing on population immunity, can we focus on population protection instead of population immunity? The fifth question, it reads as follows: what can we expect for 2022 in terms of the pandemic? What is our expectation in terms of pandemic for the coming year? The last question is, will the fourth wave be the last big wave we can expect as far as vaccination is concerned? Thanks, Minister. You'll be able to guide us who's going to handle which question. Over to you, Minister.
I believe DG, Dr. Crisp and Dr. Pillay should be there. Maybe let me just take a few, then the team can take the others. I'm not sure, Foster, with the waiver letter, what that means. Maybe somebody understands it, I don't. The mandatory on compulsory in future, as I've said, it's a matter which has been raised. We are discussing under what conditions this might be possible, and we, so it's not something which has been decided. But my own view in terms of what is possible, it's really that we don't foresee a kind of a regulation or some kind of national government regulation which says everybody must vaccinate. We wouldn't really want to go that route. But what is possible and what I believe that we would consider is where various service providers or areas of entertainment or service where people obtain particular services and even workplaces, that is a possibility where a locally determined requirement can be either at work or where people receive particular services, restaurants, cinemas, gyms, and so on, and including in workplaces to protect each and every one. We believe that those are the things which could be done, but we don't really foresee where it can be sort of a regulation as part of the disaster management to say every adult is compulsory. So that's really the direction which we think, discussing with various role players, we would maybe explore that possibility. The population immunity versus population protection. Well, I would say it's possibly just the two sides of the same coin, in the sense that if you have immunity of the population, as it's envisaged that at least 67 to 70% of a population covered will protect each other, because, as it is said, as individuals, if you do get infected, it will be it won't be severe. It will be a very mild illness. You also, in terms of the viruses which you will be emitting from as you cough and so on, it will be the viral load will be less. So you'll be transmitting very little kind of a virus. So in that way, you also protect the people around you. So I think that's really the same. What we can expect in 2022, I think this will have to get from our modelers, those who give us modeling. But from the look of things, it's going to take some time. There's going to be a number of waves. But what we are told is, and what seemed to be the route to go, is that the more we cover in vaccination, the less of this, because there will be less mutations. And if there are less mutations, less viral, people carrying less virus loads of this COVID-19, then there will be less of severe waves coming. But what is really practically envisaged now is that this virus is going to be around with us. So at that stage, we may need to consider possibly, based on the situation, there may be a need for these boosters as we go into the following year. But what is certainty is that the virus will still be